Welcome for you in this course, a helpful practice test in hypertension and its pharmacology. Congratulations for having this chance, and all I can say that I'm so proud to be with you. I am Madam Abdul Nasser Taj Taya. I am a esteemed pharmacist, American Studies instructor, author, and researcher who is teaching on Udemy. Hypertension is the most popular modifiable risk agent for cardiovascular illness and death. And decreasing blood pressure with antihypertensive medications decreases target organ injury and blocks cardiovascular illness outcomes. Many more hypertensive patients, anyway, are uncontrolled due to intolerance or non-adherence to obtainable antihypertensive agents. The opening message from this practice course is that what concerns most is having blood pressure control. Now, pharmacological counsel should be presented to whole hypertensive community and those with a powerful family history of hypertension. Anyway, such measurements may avoid the demand for drug therapy or decrease the number or dose of medications needed to dominate blood pressure. When medication therapy has to be inserted more rapidly, non-pharmacological measurements should be established in parallel with medication treatment. Thresholds of systolic and diastolic blood pressure are things supplied to direct intervention with medication therapy in commune with hypertension. Anyway, in this practice test course, I have two practice tests which contain about 30 questions to examine students' knowledge concerning hypertension definition, classification, pathophysiology, desired goals, non-pharmacological, and pharmacological treatment. Who this course is for? People from all the world who like to test their knowledge in hypertension definition and treatment basics. Many thanks for your attention, and I'd like to invite you to register in this course or try the free preview if you want to explore further.